The small intestine primary channel originates at the ulnar side of the tip of the little finger at small intestine 1, ascends along the ulnar aspect of the hand to reach the wrist where it emerges at the styloid process of the ulna at small intestine 6, follows the ulna to the medial aspect of the elbow, where it passes between the olecranon of the ulna and the medial epicondyle of the humerus at small intestine 8, runs along the posterior aspect of the upper arm, intersecting the large intestine channel at large intestine 14, to the posterior aspect of the shoulder joint at small intestine 10, zigzags from the inferior fossa to the superior fossa of the scapula through small intestine 11 and small intestine 12, and then to the medial aspect of the scapular spine at small intestine 13, crosses via small intestine 14 and small intestine 15 to do 14 at the lower border of the spinous process of C7, intersecting the bladder channel at bladder 41 and bladder 11, descends into the supraclavicular fossa at stomach 12 and connects with the heart, descends along the esophagus, intersects the conception vessel at Ren 17 and passes through the diaphragm to the stomach, intersects the conception vessel at Ren 13 and Ren 12 and enters the small intestine. A branch ascends from the supraclavicular fossa to cross the neck and cheek to the outer canthus of the eye, where it meets the gallbladder channel at gallbladder 1, then travels posteriorly towards the ear, where it intersects the gallbladder channel at gallbladder 11 and the Sanjiao channel at Sanjiao 20 and Sanjiao 22, and enters the ear at small intestine 19. Another branch separates from the previous branch on the cheek and ascends to the infraorbital region, small intestine 18, then along the lateral aspect of the nose to the inner canthus where it meets with the bladder channel at bladder 1. According to the spiritual pivot, another branch descends to stomach 39, the lower HER-C point of the small intestine.